The following portion of Acadiana Live is brought to you by Integrated Health.
Welcome back. Joining us in studio today, we have Dr. Jason Prevost of Integrated Health. Welcome. Thank you for being back here.
Thank you for having me.
So today we are tackling knee pain.
Yeah.
And I know for a lot of us out home watching, some of us are no stranger to knee pain, oftentimes stiff knees. How can we tackle this and live better?
Right. So typically a proper consultation and a proper exam designed to figure out the underlying cause of the knee pain. Many patients suffer from painful stiff knees and just don't know where to go, what to do. They've tried medications, they've tried injections, maybe even tried surgeries, and are still having that pain in that knee. So we really try to hone in on where's the pain and what may be causing it. Most of the time it's a mechanical problem inside the knee.
Now you mentioned like the stiff knees. So if anything like steps hurt or just like getting up and down, that's the time we're like, you know what, we need to find the root cause of this.
Yeah, I mean the knee's designed to bend. And if it doesn't bend enough, and for example, you need about 75 degrees of bend to climb upstairs. You need about 60 to get out of a chair. That's really all the knee does is bend for a living. Right?
Yeah.
But if it's not bending enough, we've got problems.
Yeah,
It could even lead to falls, which we have to avoid.
We have to avoid that, especially too as we get older. So
after 65,
yeah, for our friends at home that are watching this, what other treatment options are available to help with this?
Sure. So, you know, initially most folks try the pain medication route or arthritis medication or maybe injections, like we said earlier. You know, many of them that come in the office are frustrated. They've tried these things and they just don't know if there's anything out there that's different. We look at knee pain from a totally different perspective.
How so?
Well, we look at it as a mechanical device. That's really what it is. It's not that different than a hinge on a door.
Okay.
But if that hinge is not lined up properly and doesn't swing properly, that meaning the knee doesn't bend properly, then climbing stairs, getting out of a chair, getting out of your vehicle becomes a task.
Yeah.
So we really have to hone in on why is it doing that? What's the cause of it? And very often we can structure a treatment program if we can help, and we can get those knees bending properly again and get you back to doing some of the things that you enjoy.
Yeah, and typically too, for those at home that are experiencing knee pain and someone comes into you, how soon do you see your patients start to feel relief?
Yeah, that's a great question. So we've designed our knee program to where on the very first visit, for many patients, we can do a trial treatment.
Okay.
And if we get to a point to where we can do that trial treatment, we'll see a different knee that day.
Wow.
Same day.
That's amazing.
Yep.
And I know you have a special offer for our friends at home. How can they contact you guys and take advantage of this?
We want to help folks out. So for the viewers, we're going to have a nice offer for them to come in and get that knee checked out. But basically, it's calling the office. That's the portal of entry. You don't need a referral or anything like that.
You make it easy for our friends at home to kind of live pain-free or start that journey. And if you guys at home, you want to learn more, contact that number that you see right there on your screen. A $49 consultation and exam for our first 25 callers. So pick up that phone and dial that number. The address for their clinic is also right there on your screen. Dr. Prevost, as always, thanks for hanging out with us.
Thanks for having me.
Of course. If you want to learn more, call that number on your screen. We're also going to put this on our website, klfy.com. We'll be right back after this.
Excellent.